St. Mark's Hospital. I stand before you today to discuss the financial crisis that our hospital is facing and the way my team and I have decided to go about solving it. Across the country, hospitals are plagued by rising costs. Salaries of doctors, nurses, and healthcare professionals are rising, as are the costs of medical equipment and tests we run in our hospital. One of the greatest costs that's rising across the country is that of uncompensated care, particularly with regards to undocumented immigrants. In the year 2000, over $800 million worth of uncompensated care was charged to hospitals in the 24 counties that border Mexico. Over $200 million of those dollars, or about 23%, was because of undocumented immigrants. This is a problem that is not going away. It is in fact increasing. In the year 2004, this number rose to $400 million in the state of Arizona alone. We recently at our hospital have had a case that typifies this problem, that of Mr. Oscar Yanez. Mr. Yanez is a 45-year-old Mexican national who is an undocumented immigrant in the United States. He was admitted to our hospital on August 17, 2010, showing symptoms of a stroke. He was stabilized at our emergency care facility and now requires rehabilitative care, something our hospital is not equipped to handle. We are an emergency care surgical facility and neither have the technology nor the means to provide rehabilitative care. In addressing this issue, we need to look at all the people who are really involved, who have a vested interest in how this case turns out. First and foremost, that is our hospital. As a hospital, we are in the business of saving lives. But in order to do that, we also have to be in the business of staying in business. If we take these financial hits every time an undocumented, an uninsured person comes into our doors and needs care, we won't be able to remain financially solvent. We'll lose the surplus we've been acquiring, and we'll no longer be able to put that money into the other programs that our hospital thrives in, the emergency care and surgical facilities. The next person whose interests need to be addressed in this case is the patient, Mr. Yanez and his family, and all those like him. All patients who come through our doors deserve the highest quality of care possible. In terms of emergency care, we can provide that for them. In terms of rehabilitative care, they need to go somewhere else because, quite simply, we don't have the facilities to provide that care, so their best option is not with us. We do what we can, however, to find them places where they can receive that rehabilitative care. The next group whose interests need to be addressed is the community. We have a social contract with the community and a responsibility to provide them all with the highest quality health care possible. For emergency care, that's us. We are one of the finest hospitals in the nation of providing emergency care. Rehabilitative care is not our specialty, so that's why we contract that out. Additionally, Oscar Yanez and patients like him are often integral members of the community. Mr. Yanez specifically was an avid churchgoer, and as such, the community showed an outpouring of support when he was admitted into our hospital. The community sees him as one of their own, and they want to make sure we don't abandon him on the side of the road. They want to make sure he receives the proper health care that he deserves. We have to address the PR aspect of the community as well. The community is our base of our patients. If we lose community support, they'll elect to go to other hospitals instead. We need to keep the community happy so that they'll come to us, so that we can help them, get money from them, and put that back into the other programs we provide, such as our preventative care clinic. So the community needs to be satisfied in order to keep them coming to us so we can do what we can to provide them the highest quality health care. The last party whose interests need to be addressed is that of the US and Mexican governments. As Mr. Yanez and many like him are nationals of other countries but are residing in the US and receiving health care in the United States system, both governments have a vested interest in their well-being and ensuring that they receive the highest quality health care possible. Now I'd like to walk you through what a patient goes through when they're admitted into our hospital in critical condition to the time they're discharged. All patients who are admitted are stabilized at our facility. That was mandated by law from the Emergency Medical Treatment and Active Labor Act. What that says is the US government requires us to treat all patients admitted into our hospital in critical condition to do the best we can to stabilize them. That is regardless of the patient's nationality and citizenship status, and regardless of whether or not they have insurance. Anyone who comes into our door in critical condition is stabilized. Next, we see the paths begin to split. For the patients who are insured, we find a rehab facility for them where their insurance takes over and pays for them. They're discharged from our hospital. They go to whichever facility we deem best appropriate for them, and their family decides it's appropriate for them, and the insurance pays for that. The problem begins when the patients are uninsured. The first thing we do for uninsured patients who require rehabilitative care is seek a charity grant. We see this as the best option for several reasons. First off, if it's a charity bed, the U.S. government isn't paying for it in the form of Medicare or Medicaid and any other programs like that. Next thing is the rehabilitative care center themselves are often able to give a tax or write off a tax break by providing such a charity bed. These beds cost thousands of dollars, and as such, it's beneficial for them to be able to write that off. However, in our failing economy nowadays, these facilities are often no longer able to give away those thousands of dollars in care for free, and as such, they need to be paid for their services. So if we're not able to find them a charity bed, the paths split again. If someone is a legal resident of the United States, we are often able to assure that they will have a bed at a facility which will be paid for by Medicare or Medicaid or other government programs. If this is not the case, if they're not a legal resident, as we see in the case of Mr. Yanez, if they're an undocumented immigrant, then we advocate the policy of medical repatriation. What medical repatriation offers is the highest quality health care possible for these patients in a rehabilitative manner in their country of origin. We contract out to a company called MexCare, who, once we discharge the patient, takes control of the patient, and takes control of the patient and ensures that they're delivered to the country of origin to receive the highest quality rehabilitative care possible. At this time, I'd like to turn it over to my colleague, Dr. Lance Gonzalez, the Deputy Administrator for Outpatient Services. He'll talk to you a little more about the rehabilitative process and medical repatriation.
Thank you, Dr. As Dr. Emert said, my name is Dr. Gonzalez, and I'm going to be talking to you essentially about the Mexican repatriation program, in addition to, I guess, the justifications that we use for that. Let's first talk about medical repatriation. As Dr. Emert said, we contract out to a firm called MexCare. MexCare is essentially a transportation/ambulance service that takes uninsured, undocumented patients from the United States and transports them back to their country of origin, where they're able to receive a high quality of medical health care. We see several advantages to MexCare, both on the patient side and the hospital side. For the patients, the first and most obvious advantage is that they're going to receive high-quality health care that they otherwise would not have been able to get had they stayed in the United States. Furthermore, we'd like to point out that MexCare is also a completely optional program. If patients don't want to take part in MexCare, they don't have to. They don't have to be deported if they don't want to. This is important not just for the patient at the hospital, but also for potential future patients that may come to our hospital that are undocumented and uninsured. If they believe that they're going to be deported every time they seek health care, then they're going to end up not seeking health care, which will decrease the quality of health overall for that segment of the population. It's for that reason why it's important that MexCare is optional. Furthermore, the final benefit that MexCare has for patients is that it keeps families together, and it makes every effort to help families out. If the family so wants to, they can travel back to the country of origin with the patient. And furthermore, MexCare makes every effort to provide a basis for that family to reestablish themselves if they need it in that country of origin. They ensure that they have housing, they ensure that they're able to get their feet back on the ground and establish themselves back in that country of origin. Additionally, MexCare has several advantages for the hospital. First of all, the primary one is that it's very convenient to us. Once we know that a patient has been stabilized and that they require long-term rehabilitative services that they can't afford and they have no insurance in order to pay for it, we're able to contact MexCare. We know that eventually that they're going to have the opportunity to receive high-quality healthcare service. Furthermore, we contract out to MexCare because of the cost savings that it brings us as a hospital. MexCare is able to charge us a very low amount of money compared to what it would have cost to rehabilitate these people and pay for the rehabilitation. Essentially, we see three different justifications for our medical repatriation program. First, financial. Medical repatriation allows us to save money, which allows us to operate at an optimal level as a hospital. We also see a legal justification based on the fact that we comply to all government standards, which allows the government to let us keep our doors open. Furthermore, we see an ethical justification based on the fact that we are fulfilling our duties as a hospital and that doctors, and additionally, we're making every effort to attempt to maximize the benefits for all stakeholders in this event. Let's first talk about the financial justifications. Before we talk about this, we need to realize the limitations on our hospital. We are a non-profit corporation. That means that every dollar we bring in must somehow be reinvested into the hospital or the community. That means that we really have no money to fall back on if we start falling behind on funds or payments. This also means that we must be very careful with how we spend our money and very cognizant of how we get our money. Our money essentially comes from two sources. The first source that our money comes from is reimbursement from state or insurance companies. When we get money from state insurance companies,